My name is Veronica Shanklin. I am the founder and CEO of Dementia Care Warriors, and we're based in Dallas, Texas. We're a nonprofit organization who provides resources and support to dementia family caregivers. I have been a caregiver myself, a full-time caregiver for both my mom and grandmother for the past 13 years. And so that's where my passion comes from in educating caregivers, providing wellness spaces and community to dementia family caregivers. And it's something I'm really passionate about. Um, Welcome any new attendees who are new to Dementia Care Warriors. Um, and first, I want to talk about just really quick why this webinar. So this is a topic that caregivers are faced with. You want to know more about cannabis, more about if it's something that could be helpful for your loved one, and just to kind of get some information. So we aren't necessarily here to tell you to use cannabis as a solution for your loved one. We just want to make sure that you are informed, that you have options, and that you know where to go when you're looking for what it is that you need. So I'm actually going to do a quick introduction of our speaker today, Whitney Wacker from Leaf 411, and then we'll go ahead and get started. So Leaf 411 is a trailblazing nonprofit organization redefining cannabis education and healthcare support. As the first national cannabis nurse helpline and guidance service, they provide trusted evidence-based information to the public about the safe and effective use of cannabis, marijuana, and hemp. Founded in 2019, Leaf 411 was built on the belief that healthcare equity must extend to cannabis education. At their core, they value compassion, integrity, and accessibility. And their passionate team of nurses is not only shaping the healthcare standard in the cannabis space, but they're also building trust in underserved communities and advancing public understanding and advocating for fair, just opportunities for everyone to reach their full potential in health and awareness. So I'm going to go ahead and turn it over to Whitney. She can tell you a little bit about her and we'll get started.
Thank you very much for that intro, Veronica. I'm going to be sharing my screen here, so just bear with me. Alrighty. And you let me know if you don't see any slides. But again, welcome everyone, and thank you very much for joining us this evening. I know your time is valuable. Like Veronica said, my name is Whitney Wacker, and I'm a registered nurse with Leaf 411. Every day, I get the privilege of talking with patients and caregivers who, like you, have questions about cannabis. I'm glad you're here. And thank you to Veronica and the Dementia Care Warriors for bringing us together. So today we'll be sharing essential information about cannabis and hemp medicine and how these products may be used safely and effectively. Whether you're completely new to cannabis or exploring it for a medical condition or simply looking for trustworthy information, our goal is to help you better understand this rapidly evolving area of healthcare. So let's quickly review our agenda and dive right in. Our session today will focus on foundational cannabis education. We will discuss the history of this plant, current Texas laws. Sorry, North Carolina, we can talk about that later. But we will also talk about how cannabis works in the body. We'll talk about different cannabinoids and products, resources, and basic dosing concepts, safety considerations, and those resources available for additional support. We'll also explain how Leaf 411 nurses can serve as a resource when questions arise. And like we said, at the conclusion of today's presentation, we will leave time for questions and discussions. So write them down or share them in the chat, and we'll talk about them later. So before we dive into cannabis medicine, I'd like to tell you a little bit more about Leaf 411 and why we were founded. Over the last 20 years, cannabis and hemp products have become much more available, but professional guidance can still be difficult to find. And many people are left trying to answer very important questions on their own, like where do I start? What product should I choose? And will this interact with my medications? How do I avoid unwanted effects? Well, Leaf 411 was created to help fill that gap. We're a nonprofit cannabis nurse helpline and guidance service, and we connect the public with healthcare professionals who have specialized training in cannabinoid medicine. We combine our traditional nursing experience with our specialized education in cannabinoid science and therapeutics. And like Veronica said, our mission is very simple. We want to provide education and directional support about the safe and effective use of cannabis and hemp products because we do believe everyone deserves access to trustworthy information. In addition to our helpline and guidance services, we also provide community education programs like today's event. And before we continue, I need to note that today's presentation is intended for educational purposes only. We're not providing medical advice, diagnosing conditions, or recommending specific treatments. Cannabis may not be appropriate for everyone, and decisions regarding your healthcare should always be made in consultation with your healthcare providers. Remember, our goal today is to provide you information that helps you make more informed decisions. This has to be probably one of my favorite slides because we're going to take a step back in time. And Leaf 411 nurses know that not many people are comfortable talking about cannabis because they may be fearful of this plant, in part because there's a stigma attached to it. And there's the prohibition from the last 100 years. You know, I find it fascinating that many people are surprised to learn that cannabis is actually one of the oldest documented medicines in human history. More than 600 commercially available medical products containing cannabis were sold in the United States prior to 1937. But then Prohibition removed access to the plant, and research was limited for much of the 20th century. Today, many people have access to cannabis and hemp products through state programs, dispensaries, and retail stores. Since many of you live here in Texas, let's take a minute to talk about what access looks like here. So, Texas has both a hemp law and a state medical cannabis program called the Compassionate Use Program. We'll take a deeper look into the difference between hemp and medical here in a second, but no, the Compassionate Use Program in Texas allows patients with certain qualifying conditions access to medical cannabis with a physician's recommendation. So, again, the Compassionate Use Program in Texas allows patients with certain qualifying medical conditions to access medical cannabis with a physician's recommendation. Texas and all states' cannabis laws continue to change, and that can make it confusing to know what is legal and what options are available. So that's why it's important to use current, reliable information. And if you have questions about what is legal, whether someone qualifies for the compassionate use program, or where to start, that's exactly why Leaf 411 is here, excuse me. Researchers are learning more about how cannabis compounds may help with certain symptoms and health conditions. More scientific studies are being published each year, helping us better understand the potential benefits and risks. So, again, many healthcare professionals did not learn about cannabis during their medical training, and finding knowledgeable guidance can still be challenging. Laws, products, information, all of it continues to change, making it very difficult for consumers to know what information to trust. And because of this, many people find themselves navigating the complex and sometimes confusing environment. And that's another reason why we believe education remains so important. This is not intended to be a science class. But if you remember one scientific concept from today, remember this. Your body already has a system designed to interact with cannabinoid like compounds. It's called the endocannabinoid system, and it was discovered in the 1990s. This discovery changed how we understand balance in the body. You see that teeter-totter there? You can think of the ECS as a master regulator, and its job is to help the body stay in balance, which is called homeostasis. For example, when you're startled, your heart may race and your body reacts quickly. But the ECS is there to help bring your body back into a calm state. You don't stay in that fight or flight state for very long, unless it's something out of your control. But I digress. When something in the body moves outside of its normal range, like temperature, stress, or pain, the endocannabinoid system helps bring it back into balance. So, this ECS is active throughout the body, and researchers have found it may help regulate sleep, mood, appetite, pain, memory, our emotions, inflammation, the immune system, and finally, stress response. So, think of the endocannabinoid system like a communication system within your body. Your cells have receptors, which are like locks, and these locks receive messages in the form of keys. Your body naturally makes these keys to help control things like that sleep, pain, mood, or the appetite. And when your body is healthy, this system works well on its own. But when you're stressed, sick, injured, out of balance, the messages may not work as well, or they may not be in the right amount. So, cannabis contains plant compounds that can also act like keys. These compounds can fit into or interact with the same receptor, and they may support how your body's communication system works. After they are used, the compounds are broken down and removed, and your body continues adjusting as needed. So, why does cannabis work in the body? It's not magic, it's science. And the answer is simple. Cannabis works because it interacts with a system your body already has. My body has one too. Your body makes its own natural chemicals that are similar to the compounds found in the cannabis plant. And when your body is under stress or out of balance, it may not make enough of these chemicals to keep things working smoothly. So, the cannabis plant contains similar compounds that can interact with that same system. For example, let's take a look at the two chemical structures on the slide. The one on the left, labeled anandamide, this is made in the body. As you can see, endocannabinoid is what our body makes. And on the right-hand side, we got that purple blob of chemical structures there, and that's THC. And that comes from the plant. And I wish these were in a 3D model because you can hopefully see how similar their structure is. Because of this similarity, THC can fit into the same receptors as anandamide and can produce different effects depending on how much is used. So, cannabis compounds may mimic or support the body's natural signaling system. You can think of cannabis as something that may help support balance in the body's existing system. So, different compounds from the plant can act like the body's own signals and help adjust how those signals work, supporting functions like pain, mood, sleep, and overall balance. Let's take a look at the most common and best understood plant compounds. This slide helps illustrate the complexity of the cannabis plant. It's not meant to overwhelm you. The cannabis plant contains more than 150 different identified compounds, and the two most well known are THC and CBD. You may also hear about other cannabinoids such as CBG, CBN, CBC, THCV. There's so many other ones. But the good news is that you don't have to remember any of them. Don't memorize them, just write it down. And this is where most people begin understanding is with THC and CBD. Then, if they need to add more cannabinoids like CBG or CBN, we talk about it if there's a specific reason to do so. And us nurses, if you have a conversation with us, as we learn more about your goals, we can provide you that evidence based information on additional cannabinoids that may be helpful. The plant isn't just about its chemical compounds, it's complex. And it also has terpenes and flavonoids, which contribute to its effects and its aroma. Researchers believe that these compounds all work together in what's commonly referred to as the entourage effect. Think of it like a symphony, where multiple instruments work together to create a larger effect than any one instrument could create alone. THC, CBD, CBG, terpenes, and other compounds contribute to the overall different notes and the effect. Just like a symphony sounds different when different instruments are emphasized, cannabis products can feel very different depending on which compounds are present and in what amounts. So now that we understand at a broad level the different parts of the plant, let's see how those parts connect to real symptoms and people's experience. No, another complex slide, but that's not the goal here. It just shows how complex cannabis medicine can be. But I'll break it down for you because on the left, we've got some main cannabinoids found in the cannabis plant. Oh, look, CBC and THC. And then on the right, we've got some examples of symptoms and conditions that people often ask about. And I want to pause and just use dementia as an example. Because let's be real, many of us know what it's like when our loved one becomes anxious or restless, maybe even violent or very upset. Or maybe we all have trouble sleeping. THC works in parts of the brain that can help control mood and behavior. For some people, it may help them feel calmer or sleep better. CBD works differently too. It does not make people feel high, and some people find it helps them feel calmer. In the middle, I want to point out that when those symptoms get better, life can be a little bit easier for both the person living with dementia and the caregiver. People don't use cannabis because they're trying to treat dementia. They use cannabis because they're trying to treat a symptom. And when that symptom gets better, quality of life for everyone can get better too. And this isn't just true for dementia. People don't use cannabis because of a diagnosis. They use it because they're hoping to help a symptom like pain, trouble sleeping, anxiety from past trauma or current trauma for that matter, nausea, poor appetite. One thing that makes cannabis different is that different parts of the plant can be put together in different ways. That means the same plant can be used for different goals. Now, Two people with the same condition may respond very differently to the same product. One person may do well with mostly CBD, and someone else may do great with a mix of CBD and THC. So, there again, it's not a one size fits all. But typically, when one symptom gets better, another symptom often gets better too. Like I said, better sleep can lead to a better mood, less pain can make it easier to move. More often, I'd want to shower if I could move better. Everything in the body works together. And again, everyone is so different, so that treatment should be personalized. And I'm looping back around to this cannabis versus hemp conversation because we hear it all the time. What in the world is the difference between hemp CBD and dispensary cannabis? And so many people, once again, are surprised to learn that hemp and cannabis are from the same species of plant. I make it very simple and think of it as a dog. We have a Great Dane and we have a poodle. Both are still dogs, canines, and cannabis is a plant, not a dog, but hopefully you see that similarity there. Hemp and cannabis come from the same species of plant. The primary difference is how they are regulated and the amount of THC they contain. Dispensary products may contain higher amounts of THC and are regulated by the state cannabis programs like the compassionate use program here in Texas. Some states still have not legalized a medical cannabis program. Take Nebraska, I believe, or Kansas. Um, and those who have, take Colorado for example, have an adult use program, and that's open to those 21 or older. So the reason for all this is complex, but because THC causes impairment, these products, whether hemp or cannabis dispensary purchase, can create a different experience depending on the individual and the dose. State regulations generally require laboratory testing and quality standards, although those vary state by state. Hemp products, on the other hand, are commonly used as a source of CBD and other cannabinoids and generally contain a very low amount of THC. The current federal legal level is 0.3% THC. Don't hold me to that because that could change tomorrow. But hemp products are often sold over the counter or they're purchased online and they are shipped to you depending on the state. Current laws do not require hemp products to be tested. Regardless of which type of product you choose, you get a medical card from the Compassionate Use Program there in Texas and you shop in the dispensaries available, or you purchase a hemp product from that market, quality matters. Because testing requirements vary, we highly encourage consumers to seek products that provide a certificate of analysis and transparent quality information. Put a pin in that because I'm going to talk more about COAs in a second. We haven't really talked about how you take this product, and that's okay. But I will say how you take cannabis really matters. The different methods produce different effects. For example, we all know, perhaps, that inhaled products work faster but wear off sooner, while edibles take longer to kick in and may last longer. The biggest mistake we see are with edibles. People take a dose, don't feel anything after 30 minutes, and they take more. And then they discover 2 hours later that they've taken too much. I feel like I'm kind of jumping ahead here, but my point is knowing the difference helps you choose what works best for your needs and avoids taking too much. So let's go through on a simple breakdown of how cannabis products can be used. Like I said, inhalation. It works pretty quickly, and it's what most folks think of with the quintessential marijuana smoker. This route has value and it allows for the most immediate control. Take, for example, someone experiencing nausea. You don't want to delay that feeling. So, having something that's fast acting can be very, very helpful. And in this scenario, inhalation wears off pretty quickly. Usually it lasts less than 2 hours. So, you can adjust that in real time. Tinctures. These are products that are in a liquid form. They are dropped under the tongue for faster absorption than edibles. These effects typically start within about 15 to 45 minutes, and they're a good middle ground between inhalation and edibles. So, if edibles, these are the ones that we chew and we swallow, these can have a delayed effect because, it depends on your metabolism. But the caveat here is that this route may last longer, sometimes 4 to 8 hours. Given that they take longer to go to work, this is the route that's easy to take too much if you don't wait. And again, one of the biggest mistakes people make with edibles is taking more before the first dose has fully kicked in. Topicals are commonly overlooked. Our skin is the largest organ on our body in our bodies. And topicals that are creams or lotions or balms, they can be used for localized discomfort. They're applied to the skin for that targeted relief. Some folks have sore hips or sore shoulders or sore knees. And you can apply this topical multiple times a day because there is usually no high associated with this route. So, where you place it is where it should stay. And it can be a really great introductory product if folks are a little bit concerned. Another route that we've got listed up there are the transdermal products. These typically are patches and sometimes vary on where you apply them, but the point in this route is that it can provide longer lasting effects because it allows this cannabis product to absorb through the skin and into the bloodstream. Some patches can last up to 12 hours and they provide that steadier effect over time. One route that is not pictured up there, because some folks may not recognize that this could be a viable route, but a suppository. And again, it's not pictured, but it may be used either rectally or vaginally, and depending on the ingredients of the product, may either act like a topical or be absorbed and have generalized effects. This is definitely a case by case conversation, but again, wanting to present you all the evidence of the routes. We're going to move on to that certificate of analysis conversation because this is going to be one of the most important tools available to consumers. And what you see here on the screen is a true certificate of analysis from an independent laboratory. And it's verifying what is in this particular transdermal patch. And again, this tells you how much THC is in the product, how much CBD is present, whether the product has been screened for contaminants such as pesticides, heavy metals, or mold. And the COA helps consumers make an informed decision and it provides you a greater confidence in that product quality and consistency. If a product doesn't have a COA, you're essentially taking the manufacturer's word for what's inside. We encourage consumers to seek products from companies that prioritize transparency. One of the most important concepts in cannabis medicine is understanding milligrams and ratios. Gummy is not a dose. Many people focus on product names, but nurses focus on milligrams and ratios. Milligrams tell us how much of a cannabinoid is being consumed. 5 milligrams is a dose. 10 milligrams is a dose. 250 milligrams is a dose. And a ratio tells us how cannabinoids are balanced within a product. And you can see that in the chart on the screen. A higher CBD ratio may create a very different experience than a balanced 1-to-1 ratio. One of the most important principles we teach is regardless of which ratio you start with, start low and go slow. Small adjustments often produce better results than making larger changes all at once. So remember, the dose plus the ratio plus the delivery method equals your experience. I'll say that again. Dose plus ratio plus delivery method equals your experience. Medication interactions. This is probably the most common question we receive. Can I take cannabis with my other medications? And the honest answer is it depends. Usually, yes, especially in low doses. Sometimes, maybe. And occasionally, not until you speak with your physician, because dose adjustments may need to be made. That's why it's important to review your specific medications. Cannabis can affect how some medications are processed by the liver, similar to interactions that occur with grapefruit. Gotta love that little grapefruit warning on the side of the statin bottle, don't you? So, with that being said, this doesn't necessarily mean cannabis cannot be used, but it does mean it's important to review your medications with someone who understands and to keep your healthcare team informed. Because the higher the dose, the more important that conversation becomes. There are several excellent resources available to help nurses and other healthcare professionals and consumers evaluate those potential interactions. And our nurses are happy to help direct callers to those reputable sources, review their meds, and look at those educational materials that they can share with their whole team. Definitely are some interactions that have been published that we need to be aware of, though, and I'm happy to present them to you here today. So, opioids, narcotics. Cannabis may enhance pain relief, which can allow for some people to use lower opioid doses, and some have discontinued them altogether. Blood pressure medicines. Cannabinoids have the potential to lower blood pressure, though with low doses taken orally, the effect is usually small. People who are taking blood pressure drugs, especially those who are on multiple agents and taking, excuse me, and if they already have a current blood pressure that's borderline low, they just observe caution if you choose to explore cannabinoids. Again, cannabinoids have the potential to lower blood pressure. We know about blood thinners, especially Coumadin, warfarin. Cannabis can affect how these medications are processed, which may increase the risk of bruising or bleeding. But again, because there's that potential interaction, it doesn't mean that you can't use cannabis, but you got to let your doctor know, hey, I am going to explore this. I need you to keep tabs on my blood labs, monitor it, and let's make some adjustments if necessary, specifically for those on Coumadin and other blood thinners. Alcohol for sure. Alcohol can increase the effects of how THC feels, intensifying its effects more than wanted. So, the simple takeaway from this slide is that cannabis can change how other substances work. So, it's important you use caution and review your medications with someone who understands the complex nature of all of this. Cannabis can sometimes cause unwanted effects. And those may include some of the symptoms we're trying to tackle: anxiety, confusion, sedation, dizziness, and dry mouth. What about lack of an appetite? Good news is that many of these unwanted cannabis effects can often be prevented or improved by adjusting how much you take, when you take it, or by simply changing the mix of the cannabinoids. It's like creating your own personalized plant medicine recipe, adding a little bit more CBD in there because, hey, maybe I felt a little bit more anxious than I wanted to. But including that CBD, it may buffer the impairing effects of THC. Taking non-impairing doses of cannabinoids in the morning and adding THC in the evening can be one strategy of preventing or reducing the potential for those unwanted effects. And another strategy is increase or decrease that dose, that milligram amount, to achieve the desired effect if you're not receiving benefits. Nothing wrong with trying to keep going up to find that relief. Because cannabis does not slow breathing like some other medications. And with the right approach, most unwanted side effects can be managed. So, our safe use takeaways here. As we wrap up today's educational portion of our presentation, I'm going to leave you with a few important reminders. Cannabis is not risk free, it's not a silver bullet. It can be used safely, it can also be used unsafely. Cannabis should be viewed as one tool in a comprehensive health and wellness plan. And the key to success is education, personalization, and thoughtful use. So, if you're feeling like, God, there's a lot to learn, you're absolutely right. Cannabis medicine is super complex, but there are many products, there's many plant components, there's different delivery methods, there's individual responses that can vary from person to person. And I'm here to tell you that you do not have to figure this out alone. Imagine sitting down with one of our nurses and being able to ask, I'm new to this. What product should I start with? How much should I take? Will this interact with the medicines I take? And do I need to let my doctor know? What if I don't want to feel high? Leaf 411 takes these questions every single day. We can help you identify high quality products if there's a concern. And our Leaf 411 nurses help people navigate this complex topic every single day. We provide that education and that guidance tailored to these individual situations. Well, Whitney, how do I reach Leaf 411? I'm glad you asked. You can visit our website at leaf411.org. You can schedule a call with one of us by following that link on our homepage. Ooh, better yet, if you're on your phone, um, open the camera and scan that QR code. It's going to lead you directly to that scheduling pathway. We schedule 30-minute calls so you have time to ask your questions and get information that you can understand. We ask for a $35 donation, but if someone cannot afford the donation, we have ways to help. No one is turned away. Many of our sponsors cover the cost of the nurse guidance call so consumers can learn how to use these products effectively. So, thank you for spending time with me today, and I hope you leave feeling more informed and more confident about navigating cannabis and hemp medicine. Because remember, cannabis is complex. Start low and go slow, and you do not have to figure it out alone. Now, we'd love to answer your questions.
Thank you so much, Whitney, for that informative presentation and all of the information that you provided. I actually have some questions that people submitted when they registered. for the webinar. But if you have other questions, feel free to drop them in the chat or drop them in the Q&A function, and we will get to those as well. So with regards to the questions that were asked, you actually already answered a lot of them, and some of them were just kind of general questions. I have like, will this help my loved one with sleep? Are there benefits for all types of dementia? That's actually an interesting question. So can you talk a little bit about, is this across the board for dementia or for different types of dementia? Might it be more helpful or?
Absolutely. Great question, because sure, it depends on the flavor. If it's Lewy body, if it's vascular, if it's, insert some of the new ones that may be escaping my brain right now. But what's important is, of the current 30 or so studies, it looks at all of the different types of dementia. It's more specific to the symptoms that they're trying to tackle. So yes, we do talk to the families specifically about that, like I say, the type of flavor that they have, but the supporting evidence is more about that symptom management. And what has been published, of course, is inconclusive, but really, really promising. So absolutely, if there is, other treatments that have failed and have not met the family's need, I do think it's worth discussing it with the whole family to see if it's a good fit, because the evidence is there to support. It's just navigating it to meet that patient's need.
Okay, thank you. Let's see. Let me go finish with the ones that were submitted during registration, and then I'll jump over to the ones from today. I think you kind of discussed helping with combative behavior. Another question about sleep. Someone asked about stopping the progression, or is it a cure for dementia?
Like this question a lot, and it's not a cure. In mouse studies, I'll get a little sciencey here. There is some evidence that it can have some interesting reversal properties, but again, that's in a mouse. We're humans, so that may not correlate over. So that question still has yet to be answered, but what is being published is promising, because it is having, remember, that endocannabinoid system, a balancing effect to whether it's the blood flow to the brain or those neurotransmitters.
Okay, thank you. I have a couple comments in the Q&A, one from Barbara, who says that her neurologist will not even discuss this, and her husband is in the 4th year of dementia, doing fairly well, and they currently get their cannabis products from a dealer. And so that's what's working for them. She said it makes her husband feel good, and that's all she needs to know. And so just kind of sharing that information. And then thank you, Dr. Janine. She also mentioned that she's an avid user and distributor of hemp and CBD products, and she loves educating people about the misconceptions of cannabis and the benefits that it brings. I do have another question of, does it help with incontinence?
It brings balance back into that system. So I can't say for certain if we are urinating excessively. There might still need to be some days that we have excessive urination before it gets better. And secondarily, if we're not drinking enough, there is some potential for it to help balance out that thirst center in our brain, which there again would increase urination. So there is some possibility that it could help benefit in that regard. But there again, it's a case by case basis. Is there other things going on? Kidney disease, how well is their hydration? So we would talk with that family more in depth, but there is some potential for, again, a balancing act in that regard.
Okay, thank you. So those are the questions in the Q&A. I think I have addressed. Actually, someone said, does cannabis or gummies help with anxiety and nonstop talking or rambling?
It can. And it can also have the opposite effect. Depends on the dose and depends on the combination of those cannabinoids that are in that gummy. Also, we have to take into consideration the medication could be a contributing factor. So yes, there is that potential that cannabis can increase that euphoria or that talking, but it could also be from other contributing factors. So if it is a concern, we'd love to talk about it, because like we talked about, if it is from the cannabis gummy, a small dose reduction may be a small trial to help to see if it's the offending factor. If it is, great, you got your answer. If it's not, still got to go on a little exploratory.
Okie doke. I think we've answered all the questions does anyone have any other questions you want to drop in the chat before we close out here? We're actually like right on schedule. I think you are clearly very informative because we don't have a lot of questions. I will say that Venitra mentioned in the chat that she checked the North Carolina status. And she
Okay.
discovered that it was passed in the state Senate, but stalled in the House.
Mm.
She said, however, there is an Eastern Band of Cherokee Indian program. So I would say, reach out to Whitney if you have questions, because they work with caregivers across the country. So they're pretty knowledgeable about the different laws in different states. So if you are not in Texas, which I know we addressed heavily today, feel free to reach out to Lee 411 to get information about cannabis use in your state. Here's another question. How does it help someone in the later stage of dementia?
Sure. This is a good question too, because I think we forget that quality of life, that cannabis can help improve and has historically been doing a great job of, prior to prohibition. So even if it's just, enjoying looking out the window a little bit more or engaging in conversation a little bit more, there still is that potential to enact the endocannabinoid system, to help just take the edge off around that time of suffering. So there's plenty of studies that support cannabis use at the end of life for that quality.
Okay. Thank you. All right. So going once, going twice. Any more questions? Here's your chance. Everything you ever wanted to know from an expert. All right. I think we have answered all the questions. I think you gave us a lot of information today. So I'm hoping that that was helpful for everyone in attendance. I do want to say thank you to everyone who joined us tonight, whether you're a family caregiver, a healthcare professional, or just someone who wanted to learn more. We're grateful that you joined us tonight. At Dementia Care Warriors, we believe caregivers deserve access to trusted information, even on topics that aren't always a part of the usual caregiving conversation. So our mission is to provide education, resources, and support. And so I want to invite you, if this is your first Dementia Care Warriors experience, to stay connected, to follow us on social media at Care Warriors on Facebook and Instagram, so you can stay in the loop on these types of opportunities to get education. We host webinars, support groups, wellness experiences, and we have our annual Revive Refresh event coming up next month. So hopefully if you are in the Dallas area, we will see you there. You can also visit our website, dementiacarewarriors.org, to learn more about our upcoming programs and share our organization with another caregiver or family member who might benefit from these resources. Finally, I really would love to hear your feedback on this particular webinar and also what types of information you would want to learn about in the future. So in about 10 minutes, you'll receive a survey in your email. I think it's about 3 or 4 questions. It won't take long to complete if you could just give us some quick feedback on this webinar and what types of information you want to learn about in the future. Thank you again to Whitney and the team at Lee 411, and thank you all for joining us. We hope to see you again soon. Have a wonderful evening and take care.
Thank you.
Thank you.